Dear colleagues, ladies and gentlemen, it's a real pleasure to be here again. I will have a chance to give a little bit more formal speech at the opening, but just to say how happy I am to be here again. It's the third time we are organizing this joint symposium, this joint meeting between the ESC and the Saudi Heart Association. We have a second meeting, as you know, during the Saudi Heart meeting, but this was an idea that we had together with Hani and Khalid and some other colleagues to improve, to expand the way that we can work together, the European Society of Cardiology and the colleagues from Europe with the colleagues from Saudi Arabia. And I think it's been quite successful. And looking at the room today, I was just telling to Hani, it's really fantastic the way we've been coming over these last 3 years. So what I will do now for the next few minutes is to give you a little bit of a glimpse on one important area, or actually two important areas, on imaging and valvular heart disease. There was a lot in London. London was a big meeting, over 32,000 people, close to 33,000. There were almost 5,000 abstracts that were presented, lots of sessions, and imaging, as you know, cardiovascular imaging has evolved very fast over the last few years. And there's been a lot of clinical applications on one hand, and on the other hand, a lot of technological developments that improve the way we can use imaging, on one hand, to understand better the pathophysiology and the biology of some of the processes, but on the other hand, also to improve the application and the implementation of imaging in the study and the management of patients with cardiovascular disease. So regarding imaging, and that will be the first part. The second part will be on valvular heart disease. On imaging, I will focus mainly on two main areas, on coronary artery disease and ischemic heart disease, and then on some technological innovations that were shown in London. So this is data coming out from London that was presented just a few weeks ago. This is a very interesting study. It's called the Platform, and here the goal was to use one method which actually has both a pathology assessment, anatomic assessment by using a CT angio, and at the same time to have a functional assessment on the severity of lesions by using non-invasive FFR. This is still a work in progress. It's still a research method, but as you've probably followed over the last couple of years, particularly with the introduction of the heart flow, this is a concept that is becoming quite exciting, which is the ability to have non-invasively the assessment of both the anatomy and the function of coronary artery disease, and the goal is to improve the way we can actually select the patients for invasive coronary angiography and revascularization. So what this study did actually was to look at two groups of patients. These were patients with stable coronary artery disease, and they were planned for non-emergent, non-invasive test or catheterization. So they were put in two groups. One group was a group that had a planned non-invasive test to assess from a functional standpoint the severity of coronary artery disease, stress echo, stress MRI, whatever. And on the other hand, there was a second group which had planned already an invasive coronary angiography. And then these two groups, they were subdivided in two different groups. One underwent this new method of using both an anatomic and a functional assessment of the severity of coronary disease by non-invasive FFR, and the other one followed, if there was the planned non-invasive test, the planned non-invasive test. If there was a planned invasive coronary angiography, the patient would go straight to invasive coronary angiography. The clinical results were available to the care team within the following 48 hours, and then there was a subsequent testing and management per care team, per best practices, and then look at the usual outcome data to look at the results. And the results were quite fascinating. On the left side, we can see the group of patients who had planned non-invasive testing. So in this case, there was no significant difference between the two groups, which is a little bit expected because we had the functional assessment on one hand that could better identify the patients who had significant coronary disease. But what is really important, you can see here on the right side, which are the patients who had initially planned to go invasive coronary angiography, the group of patients who underwent the non-invasive assessment of FFR, there was a much less number of patients who had non-obstructive coronary disease, meaning that probably they did not need to go to invasive coronary angiography than compared with the usual care. So what this means is that by using this method, and again, this is still preliminary data, but potentially by using this method, we can improve the way we can select patients for invasive coronary angiography. The other interesting study that was presented also in London on imaging was the use of CMR. There was a lot of presentations on the use of cardiovascular magnetic resonance, which in my view will be the tool of the future for imaging in cardiology. In this case, was trying to look at some pathophysiological insights, studying better the inflammatory process in patients with STEMI, within the acute phase, and then following these patients. The goal here is to improve diagnosis, to improve also risk stratification, to develop potentially novel anti-inflammatory therapeutic interventions, which we know they have over the last few years also, and more recently, there have been some new identified targets that may potentially, again, be important in the setting of STEMI. And what it showed by using this method, this is a very specific method of MRI, which provides a better assessment of some inflammatory parameters. It could, on one hand, demonstrate acutely the presence of macrophage infiltration and some other parameters, and then follow up the amount of tissue edema and some other imaging parameters that could help, on one hand, to improve diagnosis, on the other hand, maybe potentially being used for risk stratification or identify new anti-inflammatory therapeutic interventions. Another important study that in the use of new imaging modalities was this new one index, so-called perfusible tissue index. And the goal here again is in patients who undergo STEMI to predict the left ventricular function recovery, which, as we know, is a very important prognostic factor in patients who undergo or who have acute coronary syndromes, and particularly the ones who have acute myocardial infarction type STEMI. So here, by using this methodology, which again of perfusion within the myocardium in these patients, when compared with the classical methods, there was a cutoff that could be used by using this perfusible tissue index, and this method, by using this method, could actually accurately predict the amount of regional functional recovery, which again potentially can improve the way we can study these patients, and we can identify the ones who may recover left ventricular function after an acute myocardial infarction. Now let me talk a little bit about some technological advances that were shown. One of them has to do with the use of, in this case, CT. And as you know, CT has been used on one hand for calcium score, but mostly now there's been a lot of work trying to look at how this method can improve the way we can actually look at the coronary arteries non-invasive. So here it's a new algorithm, and in this new algorithm, the goal by using this subtraction CT angio is to improve how we can detect calcium, but also how we can look better at the lumen, and particularly in some instances which we know are very difficult, like for instance patients who have stents. In this case, by using this methodology, you can see here on the left side the conventional CT angio in a patient with significant coronary disease, and then the subtraction CT angio, which shows very nicely with very good accuracy the lumen of these vessels, not only native vessels, but also patients who underwent previous stenting. And this again can be a potential use of imaging to study these patients. Well, fusion imaging has been around for some time, and the goal of fusion imaging again is to use a combination of the advantages of one method, for instance, with better spatial resolution, like for instance MRI or CT, and at the same time use a method that can have, for instance, better temporal resolution like echo. This new method, which was developed in Japan, is called a smart fusion imaging, and again it's a prototype, but uses in the same machine MRI and echocardiography, and potentially, can I just show you one example of a patient who has an ASD, and potentially you can have simultaneously two images, again, using the advantages of one imaging method with the other imaging method, which complement themselves and can improve the way we can study these patients and potentially, again, do better patient management. Still initial stage, but very interesting, this smart fusion imaging. The other method that was presented and also has been around for recently, but it's very exciting, it's the use of 3D printing. This is actually work coming from Italy. And here was trying to look at an improved way of looking at the tricuspid geometry, which we know it's very challenging when we use to the imaging. And by using this method, there was looking at the feasibility of 3D printing of the tricuspid valve from the images taken with transthoracic 3D echo. And here you see the resultant image, which basically provides you a 3D assessment, a 3D image of any anatomic structure, but in this case, the tricuspid annulus, which again potentially can be quite useful, for instance, for planning surgery or to understand better the pathophysiology underlying a certain disease process. So still work in progress, but very exciting. Just a word on valvular heart disease. One important area that and there were quite a few papers here, was trying to identify parameters, surrogates of left ventricular function or dysfunction or changes that can help us to understand better the patient. Morphology in relation to the coronary artery anatomy, and there seems to be some correlation between the type, if it's, for instance, this type 1B, more anteroposterior, with the type of coronary artery anatomy, which may be useful from a clinical standpoint to predict the changes that may happen in these patients. One important study on the prognosis of acute onset infective endocarditis, and what we can see on the left, the acute onset, on the right, the non-acute onset, but it shows that particularly acute onset, the patients who had deferred surgery, they had a much higher mortality compared with the patients, with the other patients, so showing the need for early intervention, probably in this setting of acute setting of patients with acute endocarditis. Just a word on the TAVI and some parameters that may help us to identify patients at higher risk. In this case, using atrial fibrillation. The pre-existing atrial fibrillation in these patients predict long-term mortality, and also the new onset of atrial fibrillation in patients who underwent TAVI predicts cerebral vascular events at short term after TAVI. So atrial fibrillation is also very important in this patient population. A word on the use of transcatheter mitral valve implantation, which is becoming also used in certain laboratories. And here it's in high-risk patients who had degenerative bioprosthesis or ring angioplasty, and this is one potential use in this patient population. And it showed that there were some sustainable good functional results. There was a sustainable decrease in the amount of mitral regurgitation and a reduction in the gradients across the valve. And here it's looking at the prognosis and evolution of functional mitral regurgitation in medically managed heart failure patients with reduced ejection fraction. We know that the presence of mitral regurgitation in these patients has prognostic implications, and again here showed that this is the case. And for instance, if there is severe functional mitral regurgitation, it is present in more than 1/3 of the patient, and when present, there is a correlation again with prognosis, with the patients doing worse if they have concomitant mitral regurgitation. And finally, here the one-year results after the mitral clip. and looking at the predictors of 1-year mortality, and we can see that the New York Heart Association status, the presence of anemia, previous order valve interventions, the renal function, left ventricular function, these were all predictors of 1-year mortality in the patients who underwent mitral clip. A final word on some new technology like the transapical off-pump mitral valve repair with the new cord implantation, and here showed that potentially use of this technique, as well as another technique which was presented by Oleg Vahanyan from France, the Cardioband, which is a percutaneous annuloplasty for mitral valve repair, and we can see here at 6 months follow-up there was good result with which seems to be, and again this is preliminary data, but which seems to be a consistent reduction in the amount of mitral regurgitation in these patients. So with this I will finish, again calling your attention for our next big meeting. It will be in Rome, 27-31 of August, and we're looking forward to have a big group of colleagues coming from Saudi Arabia. So this was in a nutshell the summary of imaging and valvular heart disease that was presented in London. Thank you very much.
Thank you very much.